Now, coming to sterilization of the laparoscopic instruments. So, this is a very important thing so that we can prevent any transmission of infection from one patient to the other, especially because a laparoscopic instrument is a long tube. There can be some blood spot which might be there stuck inside. If we don't clean them properly, then it can lead to transmission of infection. So, the laparoscopic instruments are sophisticated, complex, delicate instruments. They have bioburden, that is microorganisms and debris which can lodge into the crevices, especially if there's any break in it. As a result, they can be difficult to maintain, clean and sterilize. Moreover, due to their delicate design, gentle methods must be used for both cleaning and sterilization. Surgical facilities must be meticulously cleaned, sterilized to prevent compromise the health and safety of the patients further who are using it. Now, how do we do disinfection or our decontamination of the sterilization? Decontamination basically is to reduce the amount of antimicrobial in a space or surface. Disinfection means the process which almost all the microorganisms are killed, except the spores or the inanimate objects. So it lessens the contamination but does not remove all the toxins. Okay. Sterilization is a process which destroys or eliminates all forms of microbial life. So this is the highest form of decontamination. So disinfection, basically high-level disinfection where all forms of life except the spores are destroyed. Intermediate is where some fungi and the viruses are spared. And low level is where the mycobacteria remain undestroyed. So ideally in the laparoscopic instruments, the sterilization should be of the highest level. Cleaning and sterilization includes dismantling, decontamination, pre-cleaning, cleaning and rinsing, drying, sterilization and storage. So every instrument is dismantled after surgery, means it is opened and all the parts are separated and they are cleaned separately. So dismantling, basically we should disassemble the instrument. The instruments can be they can't be thoroughly disassembled, but then in that case they are likely to contain some blood clots or some debris which can be stuck in the shaft, which can endanger the safety of the subsequent patients. So every part of the instrument needs to be disassembled, which can be done by a trained technician in the OT, and then they need to be cleaned properly. Decontamination is the procedure which reduces the bioburden on the reusable medical devices. The process begins by removing the blood stains using damp, sterilized sponge, followed by soaking the instrument in 0.5% chlorine for 10 minutes. Special care should be taken when manually cleaning and the intricate and delicate functioning mechanisms found in the distal end of the instruments. The laparoscopic instruments have a very delicate edge. That is when the part where we hold the tissue, that part is very delicate. So if we mishandle it, it can get broken. Cleaning in difficult to reach areas will be accelerated using ultrasonic cleaner. When decontamination is complete, the instrument should be safe to handle without coming in touch with the bloodborne pathogen. Pre-cleaning, even after decontamination, many bloodborne pathogens will be there in the instruments. It is advised to use enzymatic methods like protease, lipase and amylase in just a few of many enzymes which can be readily available for cleaning. They help to clean by dissolving the blood and the protein-based dirt. And these enzymes are proteins which need thoroughly to be cleaned out. Washing the medical equipment with soap scrubs is common. Although physical cleaning can be effective in some cases, enzymatic and detergent-based cleaners dissolve and remove the material better. This ensures the instrument is free of the proteinaceous material like blood and body fluids. When cleaning the laparoscopic instruments, it is ideal to use soft brushes which allow thorough cleaning of the inner surfaces, especially when there are serrations in the edges of the laparoscope. Those serrations can harbor bacteria, they can harbor blood and body fluid which need to be cleaned. Drying. After the washing and rinsing process, instruments have to be dried. Best way is to either in an oven or do an air pistol that blows all the water droplets away. Now sterilization. So we have two methods, steam sterilization and chemical sterilization. Okay. Steam sterilization, that is the autoclave. Now, this cannot be used for every laparoscopic instrument. It can actually harm, maybe the harmonic scalpel cannot be put for autoclave. That basically has to be put in a specific steam sterilizer. Earliest, safest and most economical form of sterilization is steam sterilization. Majority of the laparoscopic instruments can be successfully autoclaved, and some of them which cannot tolerate, those we should know, otherwise we will spoil those expensive instruments. Heat deteriorates the flexible endoscopes, laparoscopic cameras, the laparoscopic lights and cables. So those things should not be put in the heat autoclaves. Those basically are sterilized using the sanitizers which we use in the hospital. Instruments that are heat sensitive and moisturizer sensitive need alternate sterilization techniques. Chemical sterilization uses ethylene oxide, hydrogen peroxide, gas plasma, peracetic acid, glutaraldehyde, and orthophthaldehyde. Laparoscopic camera charged coupled device is damaged by the chemical sterilization. Camera is always either given after cleaning with the sanitizer through the gauze, and then it is held with the sterile gauze and given in a sterile plastic bag through which it is attached to the laparoscope. It is covered with a sterile plastic sleeve or a plastic cloth, and that is to avoid contamination. So basically, if we learn how to disassemble, clean and apply particular chemical for sterilization, it can be done more effectively. The sterilized instruments need to be stored properly so that they don't get contaminated again. If the desired results are to be obtained, it is crucial to follow the manufacturer's instructions. If there is any doubt, it is always better to call somebody and take help. Expensive instruments should be handled with care before sterilization. Insulated instruments should be thoroughly inspected for any insulation leaks, especially the cautery. If the bipolar or the monopolar we use has a leak, it can lead to serious bowel injuries which may go undetected. And in the post-operative period, the patient can have a lot of problem. Other important factors which have to be taken care of is monitoring the sterilization process, packaging after sterilization, the shelf life of the sterilized instruments, and the cost implications. So this is just an overview. That is, you collect and clean and soak the instrument, then dry it, inspect it for any leaks, then it is sterilized or disinfected using ETO or the chlorhexidine sanitizer which we have. Okay, so laparoscopy basically has a lot of things which cannot be told in a small class, and it is very important for us to keep doing the laparoscopic surgeries to get a hang of it, to reduce our learning curve, and to get these things in a daily practice so that we don't fumble when we actually do it on the patient. So see you in the next class. Thank you.